Yeah, thank you so much, ma'am. Am I audible? Yeah. So, Hari Om Gurubhyo Namaha. So, before starting the topic, I would like to tell an information. So, I'm actually suffering from dengue fever. So, in case if I take a small break of 1 to 2 minutes in between slides, please cope up with me. I'm audible, right? Hello? Ah, yes, okay. So, coming to the topic of the day, cosmetology in Ayurveda. One second. My screen is visible, right? So, cosmetology. So, what is cosmetology? So, it is a branch of the allopathic science which mainly deals with alternation of appearance and modification of beauty. But now, since we all speak that Ayurveda has left no branch of science unturned, no stone unturned, so we might think that since Ayurveda was written many ages ago, does it cope up with the modern cosmetology advancements or development? So this is the doubt as a practitioners we face in our day-to-day practice. Like we cannot guarantee. Like sometimes we initially we lack the confidence to guarantee the results to cosmetic complaints and such. So we get this doubt: does Ayurveda really talk about the present day cosmetology? To that, if we think about, we can find answers in the classics at different areas. Like at Garbhotpati, in the sixth month, Acharyas explained that there is Balan Varna Upajaya of the fetus. And under Dinacharya, they mention n number of procedures for protecting our beauty, like Mukha Prakshalanam, Tambula Sevanam, Abhyangam, Udvartanam, Mukhalepa, Chatradharanam, and Nidra. And of course, Abhyanga here, it stands for both Mukha Abhyanga and Shiro Abhyanga. And in the form of Rasayana and Panchakarma. As if you see in the benefits of Rasayana and Panchakarma, the first and foremost will be Bala Varna Oja improvement. Yes. And in the form of Ganas, like Varnyak Mahakashaya Gana by Charaka and Sushruta, Lodradi Gana, Eladi Gana, and many more. And coming to its Chikitsa, there are n number of references. Chikitsa for Mukadoshika, Vyanga, Palitya, Kalitya, and there's even in Garuda Purana it's mentioned that Saundarya Vartaka Yoga. And there are tailas like Varnyaka Drita, Varnyaka Taila, Kanaka Taila, etc. And Mukakanti Haralepa, Mukha Karshya Haralepa in Baisha Jaratnavali. So there are n number of formulations or a number of treatment approaches mentioned in the not in the Bruhatraya as such, but after the Lagutrayas and further books which have been written in the further centuries. So, but even though this much is mentioned, we still get a doubt whether can we compete with the so-called advanced cosmetic field of allopathy. So for that, mainly what we as an Ayurvedic doctors do mistake is not do mistake, or sometimes we don't consider this. What is that? We don't think of the present day factors and apply them in through Ayurveda. So I thought, why not pick such 2 to 3 cases and explain them in my experience, which I have faced, so that we can, confidently practice cosmetology in Ayurveda and give them wonderful results. Like sometimes we only can't believe ourselves that Ayurveda gives such good results in cosmetics. So one such case is this first one. In this case, the important part is Garavisha in present day cosmetics. So Garavisha, uh, I hope everyone is aware with the concept of Garavisha. So it is so basically Garavisha is where when the due to combination of need be Vishadravya or need not be Vishadravya. On the combination of this, it causes effect in our body. It does not show the effect immediately, but it gets Gambira in the body, and on a long term, it causes effects. So one such example is this. So patient is a female. She is 27 years old. So she had been referred, or probably you can tell rejected by dermatologist. So her complaint was she had developed blackish pigmentation over her lips. I will show you the picture later. And over her lips and in the perioral area. So this was present to her from approx 10 years. So she had been to different dermatologists and they had tried treating her and they were unsuccessful. So this patient was referred to me by another dermatologist. So initially, even we tend to have a back step कि डर्मेटोलॉजिस्ट भी ने ट्राई किया है, वो लोग इतना 4 साल पढ़े हैं, 5 साल पढ़े हैं डर्मेटोलॉजी के बारे में, हम देखा तो बस 6 layers of Brajaka pitta, and what do we know? And Vyanavata, that presence in the twacha, and this is what we know. Can we really take up this case? But then they have already done the damage for 10 years. I mean, what else damage can I do further? So with the same courage, I took up the case. So this is a condition when she had come to me. So if you can see, there is too much blackishness of the lips and in the perioral area. So can anyone tell me the dosha predominance of this? Can anyone try? Okay, it's fine. So, did anyone message or?
Yes, I have unmuted also. If
Can
anyone
you please unmute? Otherwise, it will be.
to give the answer via unmute, and someone has also note down in the chat box. Yes, Vata.
Yeah, Vata. Very good. Why? Due to the Karshatva. But while treating, we should equally keep in mind that Brajaka is also equally important. As Brajaka, Pitta is responsible for Prakrita Varna or Vikrita Varna of the skin. This we tend to forget, because if we see in Bhatakala Akaliya Adhyaya in Sutrasthana of Charaka, after explaining about Vata, in Pitta he mentions that Pitta in its Prakrita is responsible for Prakrita Varna, and it in Vikrita form is responsible for Vikrita Varna. So here, since it's in skin, we should understand it as Brajaka Pitta. So history as a now, of course, we do search for the nidanas, because without nidanas, it's difficult to treat. Like we can treat, but there will be no short treatment. So on taking history, she regularly consumes Kattu Amla Pradana Ahara. Here I forgot to mention she also eats a lot of Vidagdha Ahara, which is again Rakta Dushti Nidana, as mentioned by Charaka. And again, she has habit of taking Alpashana Bhojana in the sense she used to take small quantities of meal in order to lose weight. And sometimes she used to skip meals. She's a homemaker by nature, so she used to skip meals to complete work. And on a history of, and she has a history of low HP levels. When the patient had come to me, she had history levels of around 8.9 or something. And when she started going to other dermatologists, one dermatologist had asked her for 10 sittings of laser treatment. So she had undergone 5 sittings of laser treatment, but then since there is no result, she had discontinued further treatment. But this is okay. These are all general Raktadushtikara Nidanas. Like it can cause any Tok rogas, right? It can cause Kushta, it can cause difficulty in her periods. It can cause, still there is a disturbance. Some participant has unmuted their mic. Okay.
इसीलिए मैं ना लास्ट में ही आपको वो करी है ना,
हाँ,
शायद चैट
ठीक
बॉक्स में ही करे तो ज्यादा अच्छा है.
ठीक है, ठीक.
जी जी, I have unmuted. Yeah, please continue.
Yeah. So as I was telling, these are all regular Rakta Tushtikara Nidana. This can even cause Jwara, or it can cause Rakta Pitta, or it can cause Kushta, Shudra Kushta, etc. But we need one Sthana Samshaya Nidana to cause it exactly in this lips. And that was this last point: history of usage of low quality or cheap lipstick even after expiry date. Now, this patient, since she is from a village backdrop, she had no proper access to a proper cosmetics, or in that case we don't really have a safe cosmetics. That's another part. Yeah, so she does not have a, she used a cheap lipstick for almost more than 5 to 10 years. So this had led to this hyperpigmentation of lips. And this is the part where we generally tend to ignore, or we generally don't ask regarding this. So this aspect of considering the present day factors such as lipstick or any makeup article such as foundation cream or any what do you say, primer, etc. This factors of present life, if we consider as Garavisha and approach, we'll get a very good positive results. Like we'll be amazed by the results. So this is the Samprapti, and Vigatana should be done here. As usual, Nidana Sevana, she got Rakta Dushti, mainly Ushna Guna of Pitta and Rakta were imbalanced. Excuse me. And further application of lipstick, making sthana samshaya and predominant changes over lip, Vyadhi manifestation, and further Dagda by laser, which was making the Gambhirata of the Vyadhi increase. And now, coming to the principles of Chikitsa, Samprapti Vigatana. So these four, I had followed these four parts of treatments. First one is Tridosha Shamana. Now you might think, because just now I had told it is Vata Pitta imbalance, and now I am talking about Tridosha Shamana. Because once this Garabhisha we started acting, it will cause Tridosha Shamana and Rakta Prakopa inevitably. So, वो Tridosha Dushti or Rakta Dushti होगा ही होगा. So we should treat Tridosha plus Rakta. And Garavisha Chikitsa, Varnya Chikitsa, of course. And Dhatu Samya Chikitsa, since she was uh, suffering from Pandu as well. So Pandu being a Sahama Rasa Roga. So initially I had given Punanavadi Mandura for Pandu and later changed it into Gritas. And Garavisha Chikitsa had given Bilvadi Gulika, a simple, cheap yet effective Ayurvedic drug. And for Tridosha Shamana and Varnya Chikitsa, I will explain now. Varnya Chikitsa I have done in two stages. One, two, not stages, two approaches. One is Sthanika Chikitsa and one more is Sarvadahika Chikitsa. So initially I had given her Punanavadi Mandura followed by Bilvadi Gutika. And for Varnya Chikitsa I had given Mahamanjishadi Gota, which sadly did not work well. Later, when I analyzed why it did not work well, so there are, as we all know, there are two types of chikitsa. One is santarpana, one more is apatarpana. So here, the pathology being more apatarpana, needing 1 second. Yeah, sorry. Here the Samprapti being more Vata Pitta predominant, we should be doing Santarpana Chikitsa here. So hence, and since I had mentioned in the Samprapti more Ushna Guna was related, this Mahamanjishya Vata did not work well. Hence later I had changed it to Sarivadhyasava Drakshasava combination, which had given beautiful results. As one, it targets the Ushna Guna, it targets the Rakta, and it's Tridosha Shamana, and hence. Coming to Grita, I had given targeting Rasa and Varnya. Here mainly I wanted to give Yashtima the Grita, but if I give the same Grita every time she comes, she won't be ready to pay the consultation fees. And in the same way, I had given Nasya and Kunkumadi Taila, Nasya with Kunkumadi Taila alternatively. along with Kavala, with Teshtimaduka Taila. And Stanika, I had given Manjishta Churna along with the Shira as a Dravadravya for Lepana. And then I had, as ma'am told, I manufactured custom made cosmetics. I had given her a lip balm made out of a Barnyataila which I have prepared. And yes, this is the result. This first photo was taken by me under in my clinic. Second, I did not meet her. She had sent me. So interesting fact is she had taken treatment for 6 months and later she had dropped for 4 months. And as every other doctor, I have also thought probably patient did not like the treatment or treatment did not work, etc. And 4 months later, she had called me. She had called me and started telling doctor, I thought after using there was very good change, but I wanted to know whether if once I had stopped the medicine, whether the darkness will recur, and I wanted to stop, and hence I wanted to try it on say for 4 months. And the feedback was even she stopped for 4 months, even she continued Nidana, the progress which she made, she did not lose it. So that is the power of Ayurveda in cosmetologic field. So see, if you can see here, there's lot of darkness, karsha, shavatva, typical vata symptoms. And here if you see there is her skin tone has also improved, but not as much as shown in this picture. This is little filter based. Her skin tone has improved and her lips had become more mardava. Here it was very ruksha and dry. And it's devoid of that jiva. Here if you see it's more lively. And then if you see the pigmentation is also reduced far better, like last 20 to 30% is remaining. So this is the results we can give to our patient if we include our daily factors, present day factors through Ayurveda, understand them through Ayurveda and approach them. But the only fact is we should, if we are seeing in cosmetology in the form of Ayurveda, we should target the dhatus equally, not only the Sthanika Chikitsa. Because Rasa will be involved, Rakta will be involved, Ojas will be involved, sometimes Shukra also will be involved. And hence, if we are approaching a patient in a cosmetical way, how much the Sthanika Chikitsa is important, equally your Kayagni Chikitsa is also equally important. So this is the first case. Second case, Kalitya. So this is a very common OPD case which we get on day-to-day basis. So importance of targeting Raktadhatu in Kalitya. Normally why I have taken this topic is, generally we tend to skip or forget thinking about Rakta while treating a Kalitya. And this part is very important because we can understand whether to do Santarpana Chikitsa here or Apatarpana Chikitsa in the hair fall. Now, you can ask me like, sir, hair Kalitya to it's a degenerative disease. Why do you want to do Apatarpana again? I will explain in the further slides. So, case, patient is female, 51 years old, menopause around 4 years ago. So she complains of hair fall and no regrowth of hair. Like she was getting bald spots. She was getting bald spots and hair fall. So hair fall was such an extent that every time she brushes hair, she almost gets a palm full of her hair. Like if she closes her face, she gets palm full of her hair. So, and as usual, on taking history, there is Rukshahara. Rukshahara here, she used to do Asneha Bhojana and she used to take a lot of Vidagdahara, which causes Rakta Dushti, and these are Ruksha in nature. And patient used to do it lot of, she used to do Adhyashana, and these all led to Ama. And she is a Stulakaya, and she has Rakta Dushti due to excess consumption of coffee. Here, coffee acts as a Drava and Ushna Nidana. which causes the dushti to the drava and dushna gunas of rakta. So, Samprapti. Here, due to all this Nidana Sevana, there is an impaired Agni. This leading to Sama Rasadhatu. As everyone know, hair fall is a Sama Rasadushti. This is the first case. Second, she being a Stulakaya, in Stulakaya, as Sushruta explains in the Staulya Samprapti, there is Ama Rasa and Ama Medadhatu. So, due to this Ama and Vruddhi of Medadhatu, there is no proper Uttarattara Dhatu Poshana. That means there is no proper Asti Dhatu Poshana. So again, Kesha is again Mala of Asti Dhatu. Right? So once the Asti nourishment goes down, its Sara and Kitavaga also goes down, leading to hair fall. So generally in the OPD basis, we target these two, Rasa and Asti. So what I am emphasizing here is importance of Rakta. Sushruta in Shudra Roga Nidana, he explains in the following way. We don't read this pathology while reading Kalitya or Palitya, or even if we read, we don't apply it. So it goes like Romakupanagam Pittam Batena Sa Muchitam Pratyavati Romani Tadha Sleshma Sashonitaha Runadhi Romakupansu Tato Anyasha Masambavaha Tadi Indraluptam Kalityam Rujjati Cha Vibhavyate. So, at the Romakupas, Pitta and Vata together, they cause the Pratyavati of Romas. They cause the hair fall. This is stage 1 of hair fall. Right? If you ask me the stages in Ayurveda for hair fall, this is stage 1 of hair fall. Next, Tata Slesmasha Shonita Runnati Roma Kupamsu Tato Anyesha Asambhavaha. So this is the second stage. So where there is Sleshma Sonita along this cause the Runnati, this block the Roma Kupa, further not leading to regrowth of hair. Anyesha Asambhavaha. So this is called Kalitya or Indralubdha. So here, so this main part, this part is a secret to hair fall chikitsa. Because if it's only hair fall and there is regrowth, so it's in the first stage. It's in the doshas of Vata and Pitta. So here you can do Brahmana chikitsa, you can do Santarpana chikitsa. But whereas, once it proceeds to Sleshma and Shonita involvement, there will be no regrowth of hair. So here we should initially do Apatarpana Chikitsa, remove this Avarana and then do Brahmana Chikitsa. So even if you are giving internal medications or be it Sthanika Chikitsa, be it Nasya, be it Taila, be it whatever form of Chikitsa you are giving, this stage plays very important role in deciding your treatment. For example, there is no regrowth of hair. So without considering this avarna, if you just think there is hair fall, there is degenerative changes, we will just do Brahmana and do Brahmana. The hair fall will further increase and the chances of regrowth will further decrease. So this part, I repeat, this part in the treatment of hair fall is very important. What does Nibandha Sangraha say about this? In the commentary, he tells this is mainly occurs in male and females the chances of this is less because Atyanta Sukumara Angaya Rajo Dushtam Sevanticha. Here the Dushta Shonita goes out through the form of Raja and hence in females the chances of Kalitya Rundralubdha is very less. Even if you see, what do you tell? Even in the regular cases also, females very rarely they come with severe hair fall. It is always the men who have this frontotemporal baldness or male pattern recession. So if someone asks you in future, like does Ayurveda really explain about male pattern baldness or female pattern baldness or why the hormone effects, you can show them this commentary. Acharyas have long back explained that due to this Dushta Shonita, only this happens. And if we take consideration of hormones also, they come under Rakta itself. And Abhyayamata Yasmat Tasmat Na Kalati Sriya Iti. So yes, and coming to the most important factor in this case, menopause. Dushtaswanita not going out. Khalitya and hence no regrowth. So this is a Samprapti. So here we should do Vigatanat 4 stages. Let's see where. Here, first and foremost, correction of Agni. Rasa Sahama Avastha should be corrected. Rakta should be corrected as I have explained till now. And Asti, Poshana should be done. So prescription I have given a simple Purnavadi Mandura 1-2 BD after food. Bringrajasva here, since it was in second stage of hairfall of Sushruta Samprapti. So Bringraj is such a wonderful drug. It's one of my favorite in hairfall cases. See, it does the nourishment for hairs. It is Kesha, it is Tridoshahara, it is Raktadushtihara, and it is Tikshna. Hence, it has the capability to remove the avarana, the hair follicles. Hence, I had selected Bringraj Asava. And then again, Arogyavadini Vati to address the Agni. And Bocomofort, this is a patent medicine by Gufic Remedies. And for application, I had given Neelibringadi Taila. And I had given my shampoo, which I had made for the patient. But you can give any Stanika Lepas too. And then coming to the result, the patient after 1 month, 90% of her hair fall has reduced. Can you imagine 90% within 1 month? I had not given any complicated medicines, or I had just advised her Patya. That too simple. I had asked her to take more Rasa Pradhana foods, Rasa Dhatu Pradhana foods such as Dadima, etc. Dadima, Draksha, Kajura, etc. And then I had just given her this prescription. Within 1 month, she had reduced 90% of hair fall, and regrowth has started. Small hairs can be appreciated. And after 2 months, her hair was totally normal. Her bald spot has got covered, and she was very happy. So this is the wonders we can do if we just read the classics, change our approach to the present day factors. And one more case, importance of Rasayana in Palitya. So patient, he's a male, 24 years. He complains of graying of hair since 2 years. So this amount of graying was in such an amount. Excuse me. This graying of hair for him is such an amount. For every 5 hairs, there were 3 white hairs and 1 black hair. But the patient was not able to, we were not able to capture it on the phone, and hence I could not document it properly. Like I tried an iPhone too, it was not able to, it looked like we were switching on the flash and taking photo. So now he had come to me for consultation. As usual, we had made him sit, we had checked his nadi, we had taken detailed history, and upon history we had gotten these nidanas. One thing is stress. Second, Ratri Jagarana. Third, Katu Ahara Sevana. Fourth, no Abhyanga to the Kesha. Fifth, Lavanrasa Pradhana Ahara. Now the reason why I have taken this case is, this is such a classical case of Palitya Nidana and manifestation. Sushruta explains same clear-cut nidanas, Krodha, Shoka, Manasika factors, Shamakruta. Due to all this, there is increase in Shariroshma, which goes to Shira and causes Palitya. So this is a typical case of Palitya with classical Nidana, classical Rupa. And hence I went Chikitsa also classical. So, same, principles of treatment. So what do we do? Nidana Parivajana is the first step in any cosmetology treatments, or in fact any Chikitsa itself. then Palita Chikitsa, and then Rasayana. So coming to prescription, we had given him Shivagutika for almost 1 to 2 months. Yashtimaduka Taila for Nasya, it contains Yashtimaduka and Amalaki. And Stanika, we had given him hair pack containing Triphala, Kalonji, Japa, Shikakai, and Rita. We had asked him to put Lepa to this and sometimes rinse off with the same Lepa ingredients along with water. And we had given him Nilibringa Taila, and I had custom made him a shampoo and I had given him to wash the hair on normal days. So yes, now after he has this condition for 2 years. After using for 1 month, after using for 2 months continuously, I had prescribed him for 1 month, but I don't know, he had used it for 2 months and I had came back. He had zero white hairs on his head. Literally zero. Even I was so shocked कि इतना fast results आ गया. He had for more than 2 years. All we did was Nidana Parivajana, and internally I had given him only one medicine, and Nasya one Taila, and Baki two were external therapies. That's it, done. His white hairs were vanished. And even after the 2 months, he had stopped the chikitsa, and for 3 months, did not use any medicine as such, but he was following the Nidanas. He did not leave the Nidana. He didn't do the Nidana Parivajana. But even in spite of that, he did not get a single white hair. So that is the power of Ayurveda in cosmetology. Like, it's a rasayana. Shivagutika is a classical rasayana. So it is Apanar Bhava. So that is this case. And these are the products which I have used. Since I have been talking about products, this is the lip balm, this is the shampoo, and this is my brand logo under which I make the cosmetics. So what takeaway points can we do in cosmetology? So it is important to consider the present lifestyle factors such as application of lipstick, makeup creams while dealing with skin especially. Because half of the times the effects are caused due to this. These have some harmful chemicals like lipstick has 1 second. Excuse me. So lipsticks have polymethyl methacrylate lead in them. These half the times act as the causative factors in the Vyadhi. And considering the role and importance of Rakta in cosmetic cases, use of rasayanas, and proper selection of drugs depending upon action. Like for example, we have n number of varnya. We have Sariva, we have Chandana, we have Yeshti, we have Manjishta, we have Lotra. But proper selection of drugs is needed because each acts differently. Yeshti Madhu's varnya action is not equal to Manjishta varnya action. Lodra varnya action is not equal to Yeshti Madhu's action. So each time we should target a different. Sometimes we should give something which is Vatahara and Varnya. Sometimes we should use which is Pitta Uttejkara and Varnya. Sometimes we should give which are Pitta Shamana and Varnya, such as rose. Sometimes we should do which are Vishodhaniya in nature, like we should do Kafahara and give Varnya. So hence proper selection of drugs is very needed. And one more point, for us as an Ayurvedic doctors, when we are treating a cosmetological case, we should give equal importance to Kaya Agni and the Sharira Dhatu Avastha. Because this is where we are in advance of the cosmetics of allopathic field or any aesthetician. Because they always see the Stanika, they don't see the Nidana, or they don't see the causative factor from where it is coming from. And hence this part is very important as it gives us an upper hand. And what we can advise as a general measures, because मोस्ट ऑफ द टाइम पीपल इसके लिए क्या कर सकते हैं, प्रिवेंशन के लिए उसके लिए क्या कर सकते हैं. सो दीज आर फ्यू dinacharya which you can advise your patients. First one is mukha prakshalanam. Here, instead of asking them to wash their face simply with cold water, you can advise them any himas, any kashayas. Any hima would be earlier for pitta pradhanas, pitta pradhana tvachas. Otherwise, kashaya or fanta would be ideal. So this boosts circulation. This will prevent Nilika and Vyanga because Nilika and Vyanga are due to Shoshana of the Rakta by Pitta. And it'll since the drugs will be present like Varnyaganas, it'll also have an added effect on the skin. Coming one more is Tambula Sevanam. So Tambula Sevanam, this is also important because if you analyze what dravyas are put in this Nagavalli and consume or as a Tambula Sevana, all are Sugandha dravyas. Now Sugandha dravyas are basically they are Pitta Rakta Prashamana and Prasadaka. So since this Tambula Sevana mainly acts on Jetrodvan in the Mukha, they remove any doshas. One second. Sorry. They remove any doshas which are caused due to Annapana. And also they help in increasing the circulation and they improve the Kanti. Abhyanga. This is one of the important and the best step in our Ayurvedic cosmetology. Because if you see in the allopathic aesthetics or cosmetology, they have very less oils. Maximum they half of them don't advise oil because they don't know its benefits. They tell it just to oxpose etc. But if we see in Ayurveda, we have n number of oils. Like we can use oil in kaphaja conditions, we can use oil in vataja conditions, we can use oil in pitta or we can use grita. So if you make any serum, oil-based serum and give it to your patient and ask them to apply as a daily measure, and anyway it's present in the social media, application of oil-based serums is also going up. It will be beneficial to you also as you will be trusting the you will be gaining the trust of the patient and at the same time you will be giving results to patient, like it improves the hydration, it improves the luster, it improves the elasticity of the skin. Udvatanam. So Udvatanam in the present day, if you want to take, especially with respect to cosmetologists, you can understand it as scrubbing action of the face. Again, it will improve the radiance. Mukalepa, it will prevent Vyanga. Chatradharanam or age old sun protectiveness. And Nidra. Nidra is the one of the important factors in cosmetology. How much ever Abhyanga you do, how much ever Mukha Prakshalana Lepa you do, if a person does not sleep at proper time, have quality sleep, all of these are into waste until and unless he or she sleeps properly. So by this, I conclude my case presentations. सर्वे जना सुखिनः भवन्तु, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्. ओम शांति शांति शांति.
बहुत
Yeah.
सरल शब्दों में और इतना इमरजेंसी में फटाफट आपने इतनी सुंदर प्रेजेंटेशन, और सबसे बड़ी बात कि आपकी तबीयत आज हम देख रहे थे कि बिल्कुल साथ नहीं दे पा रही है. मुझे अगर आधे घंटे 1 घंटे पहले भी पता चलता तो आई विल ट्राई टू अरेंज द सेकंड स्पीकर, थर्ड स्पीकर, है ना,
नहीं
सेकंड
मैडम, I had given commitment, so I.
नहीं नहीं, सही बात है. अगर आपने बिल्कुल पता नहीं लगने दिया तो लास्ट मौके तक. हाँ जी, हाँ जी. तो बहुत बहुत धन्यवाद कि इतनी अच्छी. और मैं तो मीन्स श्री डॉक्टर श्री हर्षा जी से कहना चाहूँगी कि कितने बढ़िया शिष्य है आपके, कि जो आप में गुरुत्व भाव है, जो आप में ज्ञान का एक प्रौढ़त्व है, और जो व्यक्तित्व में सरलता है, वही सब मैंने आप में भी देखी. हालांकि हमारा मिलना कभी नहीं हुआ.
Thank you.
जो आपका विषय के प्रति जो पकड़ है आपकी, और आपके गुरुजी ने एक बार आपका नाम सजेस्ट किया तो है ना, जस्ट डू इट, है ना। इस तरीके से आपने फटाफट बहुत बढ़िया तरीके से सारे उन छोटी छोटी बातों को लेते हुए मुझे लगता है कि बहुत ही बढ़िया आपकी प्रेजेंटेशन और सभी के लिए प्रेरणादायी रहेगी, और वो अपने अपने स्थान पर बहुत सारे पेशेंट्स को ठीक कर पाएंगे। तो
Thank you.
बहुत ही बढ़िया, धन्यवाद। और थोड़े से जो क्वेश्चन है डॉक्टर साहब अपने चैट बॉक्स में है, तो हम ले लेंगे।
Yeah, sure, sure, sure.
जी अच्छा, आप अगर चैट बॉक्स में वहां देख सके तो।
And first of all, I would like Dr. Heetalji for giving me this opportunity. I would like to thank her, and I would like to thank the participants for active listening and answering in the session box. And I'd be also to be grateful to my teachers for imparting this knowledge on me. And yes, we'll go to the doubts. Yes, Dr. Samita Sharma Prajakapita, yes, very good. Uh, Melasma treatment, right? So coming to melasma treatment, if you firstly see, as I have told you, now I can tell general measures, but again, chikitsa depends upon the major nidana which caused it. So if you see Ganga as a simple nature, in while Charaka while explaining Sthanika Shota, he explains that Pitta causes shoshan of Rakta and causing to Nilika Vyanga. And we, as everyone know, it's a Raktaja Vyadhi. So depending on that, what you can give is you can give Yashtimadika Grita. One. You can give Yashtimadika Grita internally in Abakta 10 ml, 15 ml, and you can give Kunkumaditaila Nasya 2 drops or 1 drop daily, depending upon the prakriti of the patient. And one more fact is, as a home remedy, if you want to tell if the patient is poor, you can give Jatifal nutmeg lepa or Vata lepa, Vata ankura or Vata lepa, Jati, etc. Or if you want to give something as a therapeutically, like you want to give some churna, there are classical references such as Manjishta along with goat milk and Arjuna Tok along with honey. Depending upon the dosha predominance, you can give. I actually am developing a soap for this and I had given to my patient, but I did not get the review back. Once I get, I'll let you know. I hope I'm clear, Dr. Usha. Uh,
बहुत ही बढ़िया, और सही में ये सच में बहुत अच्छा है। हालांकि मैंने कुछ लिखा नहीं है ऐसा, मगर आप कह रहे हो वहाँ पक्का इसमें बहुत अच्छा इफेक्ट मिलेगा। नेक्स्ट है डॉक्टर स्वप्नाली, एक्स्ट्रा हेयर ग्रोथ ऑन अपर लिप, हाउ टू ट्रीट, प्लीज एक्सप्लेन।
So extra, see, as I told again, as a cosmetologist, as an Ayurvedic cosmetologist, correct? We should see the internal factors also. We are not like the allopathy aestheticians who just target the stanika, do some symptomatic treatment, and then we send them off. So here, if you ask me, first probably it's due to hormonal issue. You can treat that, but as a stanika, if you ask me, one thing is you can try with Nalpamraditaila, Haridra, and Sudha Churna. You can ask them to apply daily, leave for 20 minutes and try off. And one more remedy which you can try is, I'm not sure of this because I am under trials. I'm trying this to develop this into project. You can take all Lekaniyas dravyas like musta, etc., not too harsh, and you can add little of kurasani ajwain and add sudha churna, and you can give them for application. For a see, and one more time, whenever you see, sometimes when you're treating people more cosmetically, people tend to blame you for developing. They would have done some apatya, they will develop some reaction, and they will come and they'll blame you. So hence, for always a safety purpose, ask them to do a patch test either on their hand or on their neck. So you can try this for upper lip.
डॉक्टर सविता शर्मा, डॉक्टर गीता बेनीवाल जी, आपका बहुत बहुत धन्यवाद सराहना के लिए। डॉक्टर पंकज ठाकुर जी ने पूछा हुआ है, सर समथिंग ऑन युवान पीड़िका।
Yavana Pidika. Okay. So Yavanapidika, as we know, as Sushruta in Shudra Yoga, he explains that it is a Vata Kapha Pradhana in the Rakta Dhatu. So since it is a Kapha Sthana, we can do Vamana first as a first line of treatment. So apart from that, as a you mean for Lepa, Pankaj Thakur, or Doctor, how is it? Like Lepa, or you need internal medicine, or how is it? Or okay, I'll explain all. So coming to the internal factors. So generally in Yavan Vedika, as far as cases I have seen, so generally they'll have Agnimandya. So first we can target Agnimandya by selecting Agnitundivati or Arogyavadinivati. Since Arogyavadini also has a rasayana effect on the skin, it will be very easy for us. Like it will act on the koshta also, it will also target the dhatu also, dhatu, rakta dhatu also. And coming to internal medications, you can give Mahamanjishta Kashaya or Patola Kashaya, etc. And initially, whenever the acne are active, go for Lepa. Don't go for any creams. Lepa you can give depending upon the dosha predominance. Even simple Lodra you can give, it will be enough. Lodra, Manjishta, or Multani Mitti. Depending upon the skin type, you can give. Skin type here again, I mean by the dosha predominant skin type, whether it's more towards Pitta or more towards Kapha or more towards Vata. So classically, it's been told that Danya Vacha Lodra combination works very well, and this I have personally tried. It works well, Danya, Vacha, and Lodra. But only thing is, you should be careful while giving to Pitta Bhaikuti person, because Danya and Vacha tend to get little Tikshna and they might cause irritation. That's it. Dr. Samida, very good. Thank you, Dr. Samida and Dr. Geeta. Thank you, Dr. Priyanka. Thank you, Varsha, Doctor. Yeah, Arsha Sheikh, dark cycle treatments, right? So again, here, so in dark circles, we generally do only Varnia treatment. So here, if you add one treatment approach more. Excuse me, 1 minute. Yeah, sorry. So, so here we should keep three targets in mind. One is, since there is Karsha, you should say Vatahara, and since there is Vaivarnya, you should take care also of the Pitta. And since it's near eye, the drug should not be too Tikshna and it should be Chakshusha. Because due to strain also, we will be getting all these dark circles, either apart from uh, removing the nidanas, due to eye strain also we will be getting. So after taking care of the nidanas, if you give something which targets vata, pitta, rakta, and which is again chakshusha, you can get very good results only with the Sthanika Chikitsa. For example, I developed an under eye cream which only I give only under eye cream for dark circles unless and until it's too gambira. So patient gets normal in 1 year. Even their pitness, that pits under their eyes also gets treated. Kindly discuss about treatments of macular amyloidosis. I have not treated any such case of macular amyloidosis, so it will be too theoretical if I tell this. I mean, since I don't have much practical exposure, so. But generally, if you see, they have Kando, etc. As far as I have listened to cases, you can give Raktahara and Kapha Hara treatment, like Aragvada, Nimba, Kashaya Patra. You can make Kashaya of it and you can give it as Lepa or you can give it them to do Prakshalna. Since I have not read it, I can't comment much on this. And yeah, nice. Like, thank you, Dr. Rajendra. Yeah, it's on last slide. My number I'll share. You can note down Dr. Arsha 9010 565319, or you can just take a screenshot of this. I'm sharing my screen once again. You can take this screenshot of this last slide. Please provide suggestions and treatment PCOD hair growth on face. Only for PCOD hair growth, since I had explained earlier, you can follow that. And treatment of PCOD, first you should see the Nidana, and depending upon that, you should first cross check Apanasana, how Apanavata is functioning. Obviously, it will be irregular. And then we should see whether Avarana is there or not. Generally, there will be Avarana in PCOD people as it's a Santarpanotta Vyadhi. So you can give any Gugulu which removes Avarna and does Vatan Lomna there, like any Apanasthana related Gugulu like Gokshura, Puranava, etc. And you can give anything which acts on HPO axis. Like if you are looking for some tablets, you can give M2 tone. Again, it depends upon whether the Samprapti is Santarpanajanya or Apatarpanajanya. If it's Apatarpanajanya, you can give something like Allos compound or Kumari based. In case if it's Santarpanajanya, you can give something like M2 tone, etc. Or best way to target is Amalaki Churna, you can give along with Abraka Basma. It will act very good on the HPO axis of the female. And as usual, Chandraprabha you can give. Others, depending upon symptoms, symptomatically you can manage. And hair growth, as I've told, you can give Sudha Churna, Kursani Ajwain, and Lekani Dravya such as Haridra, Musta, etc. Xanthelasma around eyes. Yeah, this I have got only one case and I have not got results, so still I am working on that. Actually, my mom is a dermatologist. She got very good results in allopathic. She gives a peeling agent to apply. But this I am searching for proper lepa or anything to do. Since it comes near the eyes, right? We can't give whatever the obvious which we select to give. Prescription for melasma, I have already explained. Yeah, treatment for male pattern baldness, as I told, it comes under second stage of hairfall, like kapha and shleshma shonita avarna. So initially, while addressing this, if all other factors such as rasa will be spoiled anyway in hairfall. So checking with rasa and asti, first we should mainly target with Rakta. So initially Sthanika treatments should be done to remove Avarna. This Sthanika treatment can be again of your choice. You can either do Lepa with some Tiksha Dravya such as Bhrungaraja, Japa, Triphala, etc. Or you can do Vidyakarma. Vidyakarma can be done. It gives very good results. I am doing for patient now. I still did not complete the case since I did not present it. So, or you can do any Garshana with Ichchapedi Rasa after doing with the karma or without doing with the karma. So, once you do this sthanically, then the sthanika varna removes. And then you can do Brahmana. And internally, as I said, you can do Bringarajasava. And one more important significant point which I forgot to tell you is, generally while we are targeting Rakta, we give medicine either before food targeting the Ranjaka Pitta at the Yekrut, or after food targeting the Vyanabata. So, but if you change this approach and give the any medicine which you are targeting to remove the avarna at Nishi, that is just before bedtime, it will act double X faster or triple X faster. So this point you can note down and you can try in your practice. I give Bhringrajasava at the bedtime only. So it gives very wonderful results. You can try this in male pattern wellness. You can do one thing, you can do Vidya Karma, or in case if you're not trained in Vidya Karma, you can do Garshana with Ichabedi Rasa along with the Palandu Rasa, Palandu onion Rasa, and then give Sthanika Chikitsa such as Lepa. And if Avarna is too much, you can give Nasya too with the Shadbinda Traila, and then give Bhringrajasava. Nice present. Thank you, Dr. Savita. Yeah, Pankaj, I guess I have answered your doubt, Dr. Pankaj. Vaginal vitiligo, please explain treatment, sir. Okay, see, coming to vitiligo, it's again, it's a very, as a disease, it's fine, but as a, to find out Nidana, it has a very multifactorial reason. Because one thing, Nidana, it can be Aharacha sometimes, it can be Agantuja due to Papa Karma, etc. Yes. So, apart, if you remove the Nidana aspect from mind, what treatment can you give is for vaginal vitiligo, it's actually very Gambhira disease. Because even I have got, even allopathy doctors, they don't readily take up this case. They give steroids or they refer, or they don't readily take this. So what you can do is vaginal vitiligo, you can give any not too Tikshna Thylas for local application and ask them to Abhyanga. Coming to internally, you can give Bhringrajasava. Bhringrajasava, along with that, you can add Kasisabhasma in it. Either you can add it in the bottle itself and ask them to shake and take, or you can give one pinch before food along with the Bhringrajasava, and then you can give pigmento or any cream, etc. And after that, check their Agni. And one, I mean, this medicine, my grandfather pharmacy prepares. There is a tablet called Shiki. It's manufactured by my grandfather's Ayurvedic company. That acts excellent, but if you want it, you should order it directly from there. But it acts very well in all kinds of vitiligo. That's it. Thank you, Dr. Muskan. Yeah, Asha, for pimples, blackish marks, what can be applied? See, after pimples is Karshatva, right? Generally, it's due to remaining Rakta Dushti happen there. If it's too much all over body or all over face, you can just ask them to give do Rakta Mokshana, Siravyata. Apart from that, see, this is where we should be very not careful, very cleverly select drugs. Here, see, if there is darkness, you can give Manjishta or Lodra. These both work very well. If there is too much of Raktadushti and darkness. Here, Yeshti may not work well. As per my experience, Yeshti did not work well. And one more practical, you can give Chandana also. And one more practicality here is, see, Yeshti sticks very well when you are applying as a face pack or any lepa. But that is not the same case with Manjishta Lodra. They don't stick readily. So hence, what you can do is you can add Multani Mitti or any rice flour, Godama or Varia rice flour, depending upon the condition. For example, if it's a fairly toned skin person, you can add rice flour. Or if it's a wheatish complexion, you can add Goduma. I'm not telling this as a racist. It works well. Goduma works well for wheatish complexion. Rice flour works well for whitish complexion, fair complexion. or multani milti will be a safe choice for everything. So once if you give this, it will be easy. So even patient will feel that it's not a single drug which is being given, and you can also take more money. Like if it looks like a combination of drugs. Manjista Lodra will give very good results in this. I generally give Manjista Lodra. Depending upon the case, I alter my prescription. Like sometimes I put Chandana. Yeah. Thank you, Dr. Celine Figure. What should be the hair fall? Which will be better? Shirotaram, Shirodara, Shirobasti. Yeah, of course, Shirobasti will be the first as it is the one first among the uh, Shiro Chikitsa, followed by Shirodara also you can do, but I have never got any indication as such to do. Like I have not got any such severe case because I it's difficult to convince patient to take them these many sittings of Shirodara, Shirobasti. So once they see the results, they'll do whatever you want. And depending upon content, see, as I told you, if there is avarana as such, as I told you, if there is in first stage of hair fall where there is only an vata and pitta, you can use any kesha taila. You can use such as Ishtimadaka taila or what do you say, Nilibringa. Any taila will do the work. But if it's in case of a second stage of hair fall according to Sushruta, you can use uh, Bringraja Taila which you prepare. It will act very good because it's Tikshna, right? You can add Kumari and such Tikshna Kesha drugs and you can use for Shirodhara and Shirobasti. Talam you can use. It will be easier to convince patient and to administer. Yes, we can. Yes, Dr. Asha, we can get very good results in Vidya Karma, especially in hair fall and alopecia. But depends on the stage. If it's only in Vata Pitta Avastha, and if you do Vidya Karma, there is no indication and there is no faida in doing. But if it's in Ruddha Avastha, definitely Vidya Karma will help very good. Thank you, Dr. Kimaya. Yes, how can we reduce one second. How can we reduce hair fall and promote hair growth in females? One second. Uh, and yeah, one more oil. Thyla is you can also use Bringamalaka Thyla, Dr. Arsha, for Shirobasti and Shirodara. And yes, how can we reduce and promote hair growth in females? Yes, I have as I have told, in females this Rakta plays an important role. So you can just give them what do you tell? You can just give them Abhyanga. You can check their Dhatusha Samya. It's more than enough. And weekly once you can ask them to do any lepa with Garka remedies. Or in case if they know all of it, you can just give Brungaraja Churna or any of the churnas which you want to try and see. Because they'll have, if it's in Swasthya, they will have good results. Reducing hair fall, as I told you, that Rasa Rakta Asti we should target. Mainly in females, I have seen all three of them, if they don't get serious hair fall as cases which I have seen, because their length is more, it appears more, but it's easily correctable in females. If you just give, if you target Rasa, Rakta, Asti, and Agni, it will be easy. You can follow the same prescription which I have given. Puranavadi, Bokomo, and Bringraj Asava. Uh, thank you, Dr. Sweta. Thank you, Dr. Rod. Thank you, Dr. Rashmi. Yeah, thank you. I guess we are done with the questions. Any other question?
बहुत बढ़िया है साहब। और मैं सभी पार्टिसिपेंट्स को एक बात कहना चाहूँगी, हालांकि मैं गायनेकोलॉजिस्ट हूँ, मगर डॉक्टर साहब ने जैसे डॉक्टर समिता के एक सेंटेंस पे, एक क्वेश्चन पे जो बताया ना, बिल्कुल सही डॉक्टर साहब ने मूल पकड़ा हुआ है कि अगर उसी जो हिंट है, जैसे होता है ना, चरक का पहला श्लोक रहता है लाइन ऑफ ट्रीटमेंट, है ना। और उसके बाद चरक जी एक्सप्लेन करते हैं कि ये चीज करनी, तो सच में योग्य गुरु के योग्य शिष्य है। और आपने जो, मैंने किया नहीं है उसको ठीक, मगर आपने जो बताया है ना उसके अनुसार मुझे लग रहा है कि वो करेंगे तो बिल्कुल ठीक हो जाएंगे पेशेंट। तो लाइन ऑफ ट्रीटमेंट आपने बिल्कुल सही वाली बताई है डॉक्टर साहब। तो
थैंक यू।
बहुत बहुत धन्यवाद। मुझे लगता है कि एक्स्ट्रा ऑर्डिनरी सेशन, और बहुत सारे पार्टिसिपेंट्स ने, वास्तव में लेक्चर भी अच्छा है, तो बहुत दिल खोल के धन्यवाद किया है। तो मुझे बहुत अच्छा लगता है, क्योंकि मुझे है ना मेरे वाले दिन याद आ जाते हैं कि जब मैं आपकी उम्र में थी, और जब है ना, हालांकि कहीं बोलने का मौका नहीं मिलता था, मगर एक बार आगरा में एक डॉक्टर गोयल ने इनवाइट किया था, तो जयपुर से हम आगरा गए थे, और परम आदरणीय फॉर्मर वाइस चांसलर राधे श्याम जी गुरु जी ने, जैसे ही मैं स्टेज से नीचे उतरी और मुझे कहा हेतल अच्छा बोली, तो आज भी मेरे कान में वो गूंजता है कि अच्छा, इतने बड़े व्यक्ति को, तब गुरुजी यहाँ हेड ऑफ द डिपार्टमेंट ऑफ पंचकर्म थे, और मीन्स मैं भूल नहीं सकती कि वो सराहना मेरे लिए क्या मायने रखती है। और सच में बहुत अच्छा था। रिस्पेक्टेड वैद्य पद्मश्री राजेश कोटेचा सर भी तब उसी उसमें आमंत्रित थे, और नो डाउट भाई साहब ने भी सराहना की थी। तो ये दोनों व्यक्ति की सराहना में, मुझे जिंदगी भर बहुत मेहनत के लिए इन्होंने प्रेरित किया। तो सभी पार्टिसिपेंट्स का बहुत बहुत धन्यवाद कि इस तरीके से आपकी एक सराहना बहुत बड़ा व्यक्तित्व निर्माण कर देती है, तो आपको करनी चाहिए। मैं पहले भी कई बार कह चुकी हूँ। तो सभी पार्टिसिपेंट्स का इतने अच्छे क्वेश्चन आंसर सेशन बनाने के लिए, करने के लिए, और डॉक्टर साहब के इतने अच्छे अच्छे आंसर के लिए बहुत बहुत धन्यवाद
थैंक यू।
कि आपने खुले हृदय से ज्ञान यज्ञ में बहुत सारी आहुति दी, और मैं समझती हूँ कि सभी के लिए बहुत उपयोगी रहेगी। और मैं अभी वीडियो भी अपलोड करूंगी इसमें, और बहुत सारे पार्टिसिपेंट्स इसको रिपीटेडली भी देखते हैं। बहुत सारे स्टूडेंट्स भी मुझे कहते हैं मैडम कुछ काम आ गया था, लाइव टेलीकास्ट नहीं देख पाए, तो अभी हम उसको और लिखने के लिए भी कई बार पार्टिसिपेंट्स देखते हैं। तो
हम्म।
उसकी उपयोगिता बहुत अच्छी है। और ये मंच इसीलिए निर्माण किया था कि हमारे पार्टिसिपेंट्स, हमारे स्कॉलर्स, नॉट अ जॉब सीकर बट जॉब प्रोवाइडर, कहीं ना कहीं वो अपनी प्रैक्टिस करे, और आयुर्वेद श्रेष्ठ चिकित्सा पद्धति है, और उसका गुणगान, उसकी सही महत्ता जन जन तक जानी चाहिए। तो इसमें आपका योगदान अमूल्य और अतुलनीय है, मैं
थैंक
समझती
यू।
हूँ कि। और आप जल्दी से स्वास्थ्य लाभ करिए। मैं समझ सकती हूँ कि बहुत बार बीच में खांसी भी हुई, और
ओह,
आप अच्छे चिकित्सक है ही, तो आप एक बार अपना स्वास्थ्य लाभ कीजिए, शीघ्र स्वास्थ्य लाभ कीजिए। और
थैंक यू।
समय तक के बहुत बहुत धन्यवाद। सबसे लास्ट में मैं शांति मंत्र बोलूंगी, आप सभी म्यूट रखकर ही दोहराएंगे। ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखात् भवेत्। ओम शांति शांति शांति। नमो नमः। विश्व मंगल की कामना के साथ आज के स्पीकर का इमरजेंसी स्पीकर बनने के लिए तहे दिल से धन्यवाद करते हुए सभी का बहुत बहुत धन्यवाद।
थैंक यू।